Hi everyone, today we're going to be talking about our new product, DIM 200. So DIM, what is it exactly? To understand what it is, we're first going to talk about indole 3-carbinol, or I3C, which is also a supplement that sometimes people will take. But this is a phytochemical that's present in cruciferous vegetables, so things like broccoli, cabbage, cauliflower, kale, Brussels sprouts, among others. When we eat these types of foods with the I3C in them, they're actually released when they come in contact with the stomach acid, and then it forms DIM, or diindole methane. The dietary intake levels, though, are actually relatively small, so that's why DIM has become a popular supplement where we can take it in more concentrated doses. And also there's, especially if people have low stomach acid and certain genetic SNPs, they have a hard time actually converting I3C into DIM, which is why instead of taking I3C as a supplement, it's sometimes better to take DIM as a supplement. Okay, so what are the health benefits of DIM? The most studied effect of DIM in humans is its ability to modulate estrogen levels in the body. So it can sort of bring them up if they're low, and it can also bring them down if they're too high. So this first research that I'm just going to present here was done fairly recently in women being treated for early stage breast cancer. They were given 150 milligrams of DIM twice a day for 12 months. And what they noticed was that they increased levels of something called sex hormone binding globulin, but essentially what that does is it stabilizes active estrogens in the body. And then it also created this shift of estrogen converting to its more weak form, or the 2-hydroxyestrone, which is associated with lower breast cancer risk, and then reducing the strong estrogen metabolite of 16-hydroxyestrone, which is known to enhance tumor production in the body. Other studies have also shown that this shift happens from that strong to more weak estrogen in healthy women as well. This study was done this year on postmenopausal women who were taking hormone therapy through an estrogen patch. And DIM supplementation can reduce overall estrogen exposure, again, by promoting this conversion to the weaker form. So this was from that study where we can see here in the red is what happened with the more cancer stimulating form of estrogen, or the 16-hydroxyestrone. The purple bars are those that did not take DIM, versus the green are the ones that did. And we can see along the bottom here with the increasing dose of estrogen patch that those that didn't take DIM, their 16-hydroxyestrone went up, versus those that took the DIM, it actually decreased the amount circulating in their urine. Over here, the green is this more weaker or cancer protective form of estrogen, the 2-hydroxyestrone. Again, the purple is those that took the patch at increasing doses without DIM. And then the green are those that took DIM. And we can see that that DIM increased the overall amount of 2-hydroxyestrone. Again, that shift that we're seeing to a more protective form of estrogen in the body. So specifically, with its anti-cancer and chemo-preventative effects, we've seen results in lab and animal research to inhibit cancer cell growth and actually kill cancer cells. It actually also has been shown to decrease the blood vessel formation that feeds tumors and modulate pathways that lead towards cancer, sometimes through anti-inflammatory and antioxidant effects as well. However, we haven't necessarily seen this specific in human studies yet. The previous trial I mentioned, where breast cancer patients were receiving DIM, while it did show that favorable shift to the weaker estrogen, which we believe to help protect against cancer, the results actually did not demonstrate that there were any reductions in the cancer incidence or recurrence in any of these women. So this was a study showing, again, with breast tissue, Higher density is known to be at higher risk for breast cancer. And this study used 23 healthy females to take 100 milligrams once a day for over a year. And there was an MRI done before and after the intervention. And there was a statistically significant decrease in breast density in those that took the DIM. So we have many studies that show that it's decreasing markers that could be associated with cancer. We just don't have the research to show specifically that it does decrease cancer. Some potential side effects include headache, gas, increased bowel movements, darkening of urine, nausea, vomiting, diarrhea. These are usually mild and are very common amongst many different supplements, but they should just be mentioned to anyone who is taking it. Also, because of its effects on hormones, it should be advised that those that have any kind of hormone-sensitive conditions, including cancer, should really take DIM only under the guidance of a healthcare professional that's managing their case. And we do know that DIM can actually affect many different drugs. So again, check with your medical provider before you take DIM if you are on any medications. We do know that actually taking too much DIM may increase estrogen levels as well. So again, another reason why you'd want to take it under the guidance of a healthcare professional if you have potentially hormone-sensitive conditions. So this is our product here, DIM 200. This is probably the maximum dose that I would recommend anyone take. We can see in the research studies that they're usually 100 to 150 milligrams. The 150 milligrams was done twice a day. So we do know that it's safe up to at least 300 milligrams. So this is a nice dose that you could just do once a day and to help with sort of any estrogen balancing issues. If there's any questions, as always, please feel free to reach out. Thanks very much.